Thank you very much. As a native New Mexican from Edgewood and then Albuquerque, if nobody knows where the first place is, but I think most people know where the second one is, it is truly my distinct honor to introduce Secretary Elizabeth Groginsky. Secretary has more than 2 decades of executive leadership experience administering public and private human services organizations at the national, state, and local levels. She previously served as the Assistant Superintendent of Early Learning for the District of Columbia, a role she had for 5 years where she administered a $160 million annual budget. She previously directed early childhood education for United Way worldwide, where she helped expand the number of communities collecting and using population-based early childhood data. And she was the first executive director of the Early Childhood Data Collaborative, a national coalition to improve state policies and practices in the development and use of early childhood data system. I'm sure there's many people in this room that have used this data set quite extensively. You can thank the secretary for that. Her experience with Head Start programs is also extensive. She began as a family services coordinator and later administered a county program and then directed the Head Start Collaboration Office for Colorado. In Washington, D.C., she oversaw one of the 8 state early Head Start Child Care Partnership grants. I've understood from the child care people there's a lot of acronyms in child care, so I'm sure that's one of them. Secretary, it's my honor.
Hey, it's taller people. It's amazing to think now I oversee a $1.2 billion budget in New Mexico, so that's exciting. I want to thank Neil Mahoney and the Stanford Institute for Economic Policy Research for inviting me here today. It's an honor to be here sharing the insights on New Mexico's Universal Child Care Program. As the first cabinet secretary of the New Mexico Early Childhood Education and Care Department, fondly known as ECECD, I have had the privilege and responsibility of helping build a cohesive, equitable, and responsive prenatal to age 5 system that can deliver results for New Mexico families and young children for generations to come. Governor Michelle Lujan Grisham gave me this responsibility when she appointed me in November 2019. Her vision and determination, combined with my experience in leadership and the work of our talented and deeply committed team, have made this progress possible. From the frontline staff serving children and families every day to our exceptional leadership team, we are united by one mission: to improve the lives of children, families, and the people who care for and educate them. We've made key policy decisions that are making a big difference for young children. Universal child care is not something that we achieved with a flip of a switch. It's something that we have built over time with intention and partnership, and with a clear understanding that systems do not change overnight. In New Mexico, this work began long before the word universal entered the national conversation. Our progress did not begin with one administration, one legislative session, or one budget cycle. It was built over 20 years by governors, legislators, families, providers, educators, advocates, researchers, philanthropy, and business leaders who kept making the case that investments in young children can change the trajectory for whole populations of children and that families deserve better. That long arc matters because when people look at New Mexico now, they often see the policy outcome. But what made that outcome possible was years of groundwork, executive leadership, bipartisan legislative action, coalition building, and persistence. One of the clearest lessons from our early work was this: fragmentation was holding us back. When early childhood programs are spread across agencies and disconnected systems, families are left to navigate the complexity on their own. Providers are left juggling inconsistent rules and unstable supports, and unsustainable sometimes. And policymakers are left trying to improve outcomes without a unified strategy. When ECECD opened its doors on July 1, 2020, it brought programs, strategies, and accountability under one roof. That was not just a structural change, it was a practical one too. It gave us the ability to think and act like a system. It gave us the ability to measure whether the system was working, not just whether more children were enrolled, but whether families were more stable, whether educators were staying in the field, and whether children were benefiting. We were building a system that could learn, adjust, and improve over time. At the same time, we knew from the beginning that this work could not be done from the top down. If we wanted a system families would trust and providers could participate in, we had to build it with them. That's why listening was such an important part of our strategy. We spent time in communities across New Mexico hearing directly from families, providers, educators, tribal and local leaders. Those conversations helped us understand the real barriers people were facing and the very different ways access looked in rural, tribal, and urban communities. That listening shaped our approach. New Mexico built towards universal step by step. The modern political arc began in 2018 when Michelle Lujan Grisham ran for governor and made early childhood a centerpiece of her campaign. She promised major new investments in universal preschool and pledged to expand access to child care assistance for working families. Once elected, she moved very quickly. In 2019, she signed the legislation that created ECECD, bringing together programs that have been scattered across 3 different departments. At the same time, the state created the early childhood. When we launched on July 1, 2020, it was the same year that she put into law the Early Childhood Trust Fund and seeded it with $320 million to begin building this long-term financing structure for early childhood. From there, New Mexico built towards universal in phases. We steadily expanded eligibility for child care assistance, first in 2019 to families at 200%. We were at 150%. Then in 21, we went to 350% and waived co-payments for families at or below 200%. Then in 2022, we expanded to 400% and eliminated co-payments for all families. That same year, 70% of New Mexico voters approved a constitutional amendment that made ours the first state to guarantee permanent funding for early education through our land-grant permanent fund. So by the time we announced universal child care in September of 2025, that announcement was not coming out of nowhere. It was the logical result of years of systems building, public investment, and the alignment of public and political will. On November 1, 2025, we did become the first state in the nation to offer free child care to families regardless of income. And then last month, Governor Michelle Lujan Grisham signed the legislation that put universal child care into state law. That is our timeline, and I think it's important because it reminds us that this was not one decision, it was a series of decisions made over time that built on one another. It was governance, it was funding, it was eligibility expansion, co-pay relief, it was increased compensation through better reimbursement rates. And ultimately, it was the decision to say clearly that child care should be available to families not as a limited benefit, but as essential infrastructure. We have made key policy decisions that are making real differences for young children. The first was moving away from the market rate towards a cost alternative methodology to set child care assistance payment rates. I knew this reform was critical because I had seen its impact before in the District of Columbia when we used a similar approach to improve compensation. By using the cost model to set rates, New Mexico has improved the compensation of the early childhood workforce, we've stabilized child care businesses, and put the sector on a path towards sustainable growth. We're hearing from the field that this reform has created true stability and opportunity. One center director in Clovis, New Mexico, said the increased revenues help our center better serve children and families, our employees, and our community. Increased wages for our staff have given them the security they needed to quit second jobs, spend more quality time with their own families, pursue early education degrees and credentials, and commit to early education as a viable long-term career. The second key policy we implemented was that expanded eligibility. In 22, again, when we expanded to 400%, 80% of New Mexico families who needed childcare were eligible. Then again, when we removed the income in November, when we made it universal in November, one family that benefited from this was Sarah and Michael Paxson, with 2 children living in Santa Fe. Even though we're nurses, we live paycheck to paycheck and cannot save right now. We would love to be home with Maeve, but we worked hard to build careers that allow us to serve our community, especially during a nursing shortage. Without universal childcare, we would need to work opposite schedules so someone could always be home. Now we can spend more time together as a family. The third piece of New Mexico's early childhood success is system transformation. That transformation was grounded in the creation of ECECD, the enactment of the trust fund, the constitutional amendment requiring investment from the land grant. Together, those decisions and those policy changes helped transform our prenatal to age 5 system. None of this would have been possible without the deep collaboration and partnership of business and philanthropic leaders, grassroots organizers, families, providers, educators, and advocates. They all helped shape this work, and they continue to be instrumental in our success. The state also strengthened how we measure readiness and outcomes for young children in the context of their communities. In 2024, New Mexico became the first state in the country to assess 98% of its kindergarten students using the Early Development Instrument, a population-based measure of school readiness. This assessment measures how well the birth to 4 system has supported families and young children in achieving school readiness. We're currently collecting our second wave of EDI data, and what the baseline data is showing is so encouraging. New Mexico's children are outperforming expectations, evidence that our systems of support are working. In fact, 48% of New Mexico children are on track in all developmental domains, and 71% are on track on at least one individual domain, matching the national cohort. We're seeing that progress reflected in other measures as well. New Mexico was recently ranked 6th in the nation for child flourishing. I love that measure. In America's Health Rankings report. Among young children under 5, 81% are flourishing. I love this definition, meaning they show affection, resilience, curiosity, interest in learning, and that they smile and laugh often. That's awesome. Over time, these policies have changed the system. They gave providers more predictable revenue. They helped create the conditions for greater stability and growth, and they gave families more room to breathe. That includes families like Lauren Frazier, who had been a stay-at-home parent but dreamed of going to nursing school. With child care assistance, she could begin her path to becoming an RN, knowing that her children had quality care and that child care tuition would not stand in the way of that goal. In 2022, the governor also created tuition-free college, credit certificate, AA, and BA. So she was able to go back to nursing school at no cost for tuition and have her child care paid for. Stories like Lauren's remind us what this work is really about. Even as we expanded access, we stayed grounded in few core principles. Families need choice, providers and educators are essential partners, and a mixed delivery system matters. In New Mexico, universal child care means making sure families who need care can get it, and that providers have a pathway to participate in a stronger, more stable system. That was important to us because families do not all need the same thing. I know you all know that. That was important. They need options that reflect their culture, their language, their geography, their work schedules, and their values. Universal was about making sure access to childcare was not reserved only for families who could fit within a narrow and often outdated eligibility structure. And as we expanded access, we kept our focus on the larger system around it, because eligibility alone is not enough. If you expand access without building the workforce, the supply, and the long-term sustainability, you create a promise that the system cannot keep. So throughout our work, New Mexico is focused on strengthening the sector itself, supporting the workforce, increasing compensation, building supply, and improving our ability to measure outcomes and make adjustments over time. And we have worked to be clear about what we mean by outcomes. We're looking at child outcomes, but not in isolation. We're looking at family stability, workforce retention, and child well-being together, because those things are all deeply connected. Because the goal is not simply to say we expanded access or enrolled more children. The goal is to know whether children are arriving more ready, whether families have greater stability, whether educators are staying, and whether the system is getting stronger over time. And that brings me to one of the biggest lessons from our experience, one I believe is true in every state. Childcare is not a side issue. It is not separate from education. It's not separate from family economic security. It's not separate from workforce participation, business productivity, or community well-being. It is foundational to all of it. When childcare is unaffordable, unavailable, or unstable, the effect shows up everywhere. Families feel it in their budgets and stress levels. Employers feel it in attendance and retention. Schools feel it in terms of readiness and consistency. And children feel it in the conditions surrounding their daily lives. So when we talk about universal childcare, we're not talking about a niche policy. We're talking about whether we're willing to build the infrastructure children and families need and deserve. That's been our work in New Mexico. I look forward to diving deeper now with Ryan.
Well, thank you so much for that. Really excited to have you here. The part that resonated with me was the kids smiling. So kind of one of the first times I kind of left the state was whenever I was 16 years old and went to Boston. And I told my mom, I said, Mom, why don't people smile at you on the street here like they do in New Mexico? And so I had to learn there's a little difference between New Mexico and other places. I want to start just kind of understanding your career. Obviously, you've devoted your life to early childhood education and well-being. How did you pick that as a venue for what you wanted to focus on?
Yeah, thank you for that question. I actually started in more child welfare prevention, but I had the great opportunity in the late 90s, right after probably many of you know the cost of quality study had come out and showed that most care in our country was poor to mediocre. Am I getting it?
No.
Okay. And I had a chance to work at the University of Colorado, Denver on an evaluation. A group of people came together. Denver was one of the cities they had focused on. And so people wanted to take action and make sure we improved that care. So that was my entree, and it was fascinating to learn about all the important things. We worked with Thelma Harms, the late great Thelma Harms, and looking at environments in which children were learning and the quality of the interactions between them and their teachers. But then from there, I got to go on and become a family service coordinator in Head Start. I think that grounded me a lot in just understanding the power of community and families in creating better opportunities. And so you could, having come from a criminology, child welfare, I saw the upstream. And I just became passionate about working in early childhood and this learning about the science of brain development and seeing the potential when you build strong systems that work for all families, that we're all going to be better off.
Great. And we've had the pleasure at SIEPR to be able to work with your office a little, and you can very much tell the Secretary's office is very evidence-based, very in the science, very in the weeds with the numbers. So New Mexico is not your first rodeo whenever it comes to trying to innovate on these big, expansive child care policies. So as I mentioned before, and you kind of mentioned in the top, you were in Washington, D.C., where they had a universal pre-K program. Can you kind of walk us through what that experience was like and some of what you learned there?
Yeah. Well, I started my job in November of 2014, I think the same week that President Obama signed the reauthorization of the Child Care and Development Block Grant. And that, as many of you in this room know, was revolutionary. It completely changed the way federal policy looked for childcare. It was my first foray being a regulator, and so I had a lot to learn. But we did some very innovative things, and I do want to give a shout out to my husband, Scott Groginsky, who worked for wonderful George Miller on the House Education and Workforce Committee, and fought to get the cost model into the reauthorization of child care and the child care block grant. And that was key. And so, of course, to keep peace at home, I said, well, we're going to do the cost model here in D.C. And we didn't know, Louise Stoney and others came to help us. And we wrote some short piece of paper to Rachel Schumacher about how we wanted to do the cost model. But that was revolutionary. And it did truly, it brought to light how the system, the inequities in the system, because you look into your licensing regulations and you really have to look at all the things that a child care provider has to deliver and what those costs are. And so that was exciting. And then we, of course, strengthened the pre-K program, the universal pre-K in DC, and made sure that the community-based providers, were part of it. It is definitely primarily run through the school-based pre-K, but those were some of the exciting things we did, and working to build a system that was stronger, focusing on families, the needs of families, investing in infant mental health. But I would say that the reauthorization of the Child Care and Development Block Grant and that implementation was really groundbreaking.
Great. And so it's really interesting because you were able to take this big federal program and then apply that. And then you shifted into your role now as the New Mexico Secretary for ECE. Can you kind of just walk us through, you mentioned a little about the different cutoffs, but some of the mechanics of the program, especially for folks in the audience who might be thinking about studying this or trying to implement it in their own state?
Yes. So one thing is important is it's voluntary. So providers have to opt in. We don't say you have to do it if you're a licensed provider, so that's part of the process. Families come to our department. They either go online or they come into one of our offices, and they have to have a program, because we then develop a contract. We pay on behalf of the parent to the provider for their care. And so that's important. Families right now, under the new law, Senate Bill 241, if co-payments had to go into effect, which they are not for anybody, only families over 600% would pay a copay. So that's the law.
And what's the size of the copay? Does that depend on?
That is so interesting. Yes. Yeah, so it's Haley, our director of policy research and policy.
Sorry, yeah.
I do know it's we get to set that. So we're in rulemaking process right now, but it can't be more than at the 600 to 900%. It can't be more than 25% of the rate.
Okay.
And at the 900 and above, it can't be more than 50% of the rate.
So even if you're doing pretty well in New Mexico, still a very heavily discounted program.
Yes,
yeah.
and it only goes into effect if there's some economic downturns or our projections and how many children we're going to serve exceeds 3%. Thank you. Exceeds 3%. So we have to give that to the Legislative Finance Committee every August, what we're projecting that we're going to serve. And for this year, we're pretty right on where we, even though we started mid-year with our projections. Right. There's some other important pieces. You do have to be working or in school, all families, unless you're a grandparent raising your grandchildren, and then you are eligible regardless. Of course, all of the other risk factors, families experiencing homelessness, families involved with the child welfare system, they're all automatically eligible.
That's amazing.
Yes.
Okay. Go ahead.
The other thing I wanted to say about our new law, it's very good. It was an interesting process because it started with the Senate Finance Chair and his staff bringing us a bill, and it needed a lot of work. But it was an iterative process over we only have a 30-day legislative session, if you can imagine. So all this happened. We were like daily communicating, but there were concerns about private equity. And so we have a section in there now around how providers have to report kind of their business model. There were also concerns about that frontline staff, educators in the classroom, were not benefiting from some of these increased reimbursement rates. And so there's requirements now that they have to put their salaries, their credentials into our professional development information system. So all these things are coming online, and we'll have such a better view and perspective of who's in our childcare sector, what our childcare sector looks like, and so they have to make this report annually to us, and then we have to make a report to the legislature.
That's right. I think it goes back to kind of your point where you said it's not just expanding access; it's actually evaluating how it's working. Exactly. And it sounds like everything you guys are doing, you're tracking almost every single kind of variable or data set you can to kind of see, okay, well, what's actually the outcomes of this? Now, I want to take a step back a little bit and talk about creating this bill, which gave universal child care. And this came into effect in November 2025. That obviously, as people in this room know, particularly the folks on political staff, that involves a lot of difficult coalition building and finding agreement and understanding where you got to let things go. So what were some of the biggest challenges you saw going into the actual adoption of universal child care?
Yes, so as I described the arc, the governor was always clear from day one where she was heading. And in the 25 State of the State, she said, we're going to do universal child care. So we came out of the session and we didn't get all the revenues we needed, but she was like, Secretary, go get it done. And I'm like, okay. Luckily, we had people like the Low Income Investment Fund helping us do the supply and demand. So if you were paying attention and watching, you could see where we were heading. But I would say the provider community felt caught off guard. The legislature did not like that it happened without we did it through rule. So we changed our rules and we said there's no income limits. And so there was, So we did our rulemaking, and we got like 187 pages of comments. Most of them not very nice, but some were nice, some were nice. But they did help us improve the rule. Things like families who didn't have status, they wanted them to be paid for, so we made that change. We got some great public comment on that. We also got comment that our rates still weren't good enough to do the kind of things that we wanted to do. And two things that we did in this universal child care is we have our standard rate, and we created something called the enhanced rate. This was an important piece. You could opt into it. You didn't have to get it, but if you wanted those higher rates, you had to be open 10 hours a day, 5 days a week, and agree to pay a certain entry-level wage, depending on your quality level, either $16 an hour or $19. And so first we had it at 18 to 21. We got a lot of feedback that wasn't sustainable, that wasn't going to work. And so we did make that adjustment to 16 to 19. And I think that's still a little bit of a source of contention that, it should have been higher. And we agree. I mean, increasing compensation of the workforce. So I may have lost track of the conversation, but I
no. That's a challenge. Is making sure the workforce is happy.
Exactly. But so when it came out, it surprised everybody a little bit. Families were the most happy, let me just say. We had no complaints there. They just wanted to figure out how to get on. And I do have to give a lot of credit to our team because we did a ton of communication, made sure people knew about it. And we were really building the groundswell for why universal child care made sense and why it made sense for New Mexico at this kind of critical juncture as our administration is ending its term. But also the revenues are there. Just so you know, the $320 million trust fund is now at $11 billion. And so in the bill, this is a critical factor, I should have told you. In the bill, it says the legislature can appropriate up to $700 million between this year all the way to 31 out of that trust fund to support child care. Because we knew we had to give some certainty to the market. I mean, if it's going to be budget cycle to budget cycle, providers weren't going to expand their businesses. Families were going to, maybe I'll sign up. But, they were still going to be on this uncertainty. So that was huge. The Senate Finance Chair actually wanted $1 billion set aside. And through the negotiation with the House, it came down to $700 million. And that's what the governor signed. So that gives the confidence to the sector and also to families.
Yeah, so for those that are unaware, the state of New Mexico actually produces more oil than the country of New Mexico. It's the second largest oil producer in the state, and its trust fund relies a lot off oil sales. So suffice it to say, it's a very weird butterfly effect of history that Donald Trump bombs Tehran, and New Mexico now has more funding for universal child care directly as a result. It's a very, very weird relationship. I don't know how I feel about that.
But I would say, as Dr. Haley Hines pointed out, it is now growing. We get about a 6% growth. So as that trust fund is at $11 billion, it's growing 6% just on its own, with or without oil and gas revenues. But to your point, and also we get now the land grant permanent fund, which funds home visiting and pre-K. And that comes in about $180 million right now. But that trust fund, I think, is at 30 or 40 billion. Wow. So that also is being invested by our State Investment Council, funds public schools, funds higher education, and now early childhood.
Excellent. And then if I can go on the flip side, whenever you were coming into this, what was something you thought would be a really big challenge and then was actually a lot easier than you thought? Or I'm sure nothing about this was easy, but I should say easier than you thought.
Yes. Getting families enrolled and getting their care paid for was the easiest. And it went with a lot of work, but we had 1,000. Did we have 1,000 on day one? I think on November 1, we had 1,000 people come through the system online. And, we were at 31,000 children having their care paid for in October. And now we're at almost 45,000 in just 6 months. And so that was pretty easy. I do think, the providers have responded positively now. At first, you can understand. We put them, they're like, well, what if I don't want to do it? And my families, want childcare. We're like, no, you got to work that out. That's the market, right? Yep. We'll help with that, but they make us the bad guys sometimes. But some providers haven't opted in, and we've had a lot of robust discussions about, well, can I just limit it to some? And but I think that's been the easiest for families, and the providers are still working through it. But 58%, I think, now of our providers have taken up the enhanced rate, or maybe just a little over 50. And we're on the right trajectory. We do have, I think your probably next question is what's been the hardest.
And
that is making sure that the supply. and that it's quality and that it meets the needs of what families want. We set a goal when we announced universal child care, because I told the governor, all the things that you would tell somebody, we don't have enough supply. What about the workforce? No, done. We're doing this. We're gonna bring people together. We're gonna work on the supply. We have, with the free college, tuition-free college, we can get people into college, certificate-bearing programs. And so we brought them together, and we set a goal of 1,000 registered homes. That's a facility that can serve up to 4 children, a home. Licensed 120 more licensed homes and 55 centers. And we based it on the wonderful work that LIF had done, kind of saying we got about 12,000, and I know that's nothing compared to California. I read the policy report, the 600,000, but nonetheless, scale. We needed 12,000 more infant and toddler. And so we said we're going to do that, and we needed 5,000 more professionals to meet that goal once we build the brick and mortar. The governor had invested in a low-interest loan, and great response to that. Of course, it didn't have enough money in it to meet everybody's need, but again, I think the supply building continues to be the issue that we stay focused on. In the same legislative session that we had universal child care, we passed Senate Bill 96, which is a very progressive bill that addresses local zoning. LIF also helped us with this. But they'll take conditional use or special use permits, and there were all these things that we knew were hampering supply growth for centers and homes especially. And we also put in that bill that homeowners associations could not prohibit family child care in their whatever they write, the ordinances or their covenants. And so that was huge. I think very few states have done that. It passed, as we were saying earlier, the homeowners association, I think, got the best bipartisan support, because I guess people have feelings about homeowners associations that actually benefited us. But so we're going on the road. We're starting in May, and we're going to 7 cities to make sure local leaders know about these new laws that they cannot restrict. We had the Firefighters Association with us, the state fire marshal supporting us, and we're also going to use it as an opportunity to bring together people who we know are caring for children and say, have you heard? Would you like to become part of the sector? How can we get you engaged and get you supports and funding and resources? So that starts next month.
Awesome. So you're just really out there, just on the trail, telling people, yeah, look at that, a little bit of abundance here in child care too, with the deregulation. I want to, with the workforce, zone in on that a little more. New Mexico, I'm just personally beaming with pride, because as a New Mexican, the state is often seen as the poorest in the country, and everybody knows whenever I say I'm from Albuquerque, this is Breaking Bad, right? And it's just like, I only cooked meth for 5 years, not my whole life. It's a joke. But New Mexico is the first, as far as I know, the first and only state in the entire country which has this kind of cradle to career. Because as you mentioned in the top, the governor in 2022 signed a universal college as well. So now, from the time you're a kid to the time you graduate college, there's state programs that are there to help you succeed and flourish. Can you kind of talk a little bit about how you see these as complementary and how these policies fit together?
Yes, they're very complementary, and I really give a lot of credit to our Secretary, Stephanie Rodriguez of the Higher Education Department, who led that effort, and first in the governor's office and now as the Higher Ed Secretary. And we do everything we can to remove those barriers to getting credentials, to getting those degrees. The other thing you heard about, like the mom who wanted to become a nurse, a woman came up to me at a conference and said, "You've changed the lives of generations of women." Often it's women who have the caregiving responsibilities, and so if their partner is working, but they don't have this child care bill, I can go become an educator, a nurse, pursue opportunities. And so we see removing these truly structural barriers are going to unleash some incredible potential in New Mexico for families and for children and for women in particular.
Yeah. So kind of one last question here, and then I think we can turn it over to the audience. But our director at this point, Neil Mahoney, likes to often say, there's a lot of young people in the room. What advice would you give to young people? There's a lot of young people in this room, no doubt. But the median age is a little higher than, for example, something with a lot of undergraduates. But there is so in that sense, I want to give you a much more difficult question if I can. And there's a lot of policymakers in this room. A lot of people in this room who are out there today trying to carve out a similar kind of program to New Mexico or figure out how to expand access. What would be your advice to everybody in this room trying to do that?
I mean, I definitely think looking at your governance. I mean, I know it's a little geeky, but it is key. I mean, if your governance is all spread out and you can't see the system and you can't see where you have the opportunity to improve. So I would definitely say that, and you've got to figure out the funding formula. So I thought that was so smart of the governor when she immediately created the department. The next year she's like, we got to have more funding for it. I mean, early childhood programs are notoriously, historically, the most underfunded programs in our country. So bringing them all together does not create an economy of scale. So you've just kind of brought, and it was actually true. Well, one of our early intervention programs was part of the public health, Department of Health, and they were in a program, they're like, oh yeah, we always have $1 million deficit, and so fills that with, their program. I'm like, oh, well, we don't have that program here. So, you have to get the funding right. And I think we've done not only childcare cost modeling, we have modeled their entire system, direct service and quality and infrastructure. And that has been a big boom, just to understand how off we are from the revenues. And then, of course, the coalition building. You have business leaders and researchers, of course. Economists are key. But as always, yes. I was just saying we need more economists in our department, and just the families and the educators. But keeping those coalitions together. And they're not always going to agree, but you're going to need all of them. We absolutely needed the business community to get the department formed, and then to work on the trust fund because some of the advocates weren't. And, it's always a push and pull, but I think you have to do those partnerships and take the long game. It's not going to be a one and done, but keep building the system from the ground up, and also smart policies at the state level.
Great. And there's one thing I actually wanted to share with you. So I have these two friends, Jet and Emma. They have one child. Emma was just pregnant with another child. They're right there. Okay. And they were deciding whether or not to leave the state. So Jet, for example, has previously worked for Google. Emma has a master's degree in environmental policy, and they had jobs in other states that they were considering. Now, the family's in New Mexico. They wanted to stay in New Mexico, but they just didn't know what the cost. And whenever the universal child care expansion came out, they decided we're going to stay in the state. Yay. So for the economists in the room, this is the marginal household, actually. I found the marginal household. So, it's a very rare thing. And there's Maisie, their daughter, importantly, he's kind of sprinkling sopapillas on her head, which, if you don't know, this is a way you get baptized in New Mexico, is they sprinkle sopapilla crust over you.
I didn't. That's good. I got new facts.
Yeah, exactly. So that's Jet, Emma, and Maisie. Okay, so now we're going to kind of open it up to questions from the audience. So if you want, just raise your hand and we'll get you guys a mic. Yeah, right back here.
Hello. Hello. Is this on? Secretary Groginsky, thank you so much for coming and sharing your incredible insights. We know you're a little busy. Yeah. I'm Stacy from Children Now, and I wanted to ask, you may have heard we have a very complex gubernatorial election happening. I know, we don't know what's happening day to day. But in California, we're a big, expensive, complex state, lots of challenges, lots of priorities. Can you share more in terms of your line sight to the governor's thinking and sort of the difference you've seen about why childcare versus all the other things? I'm sure New Mexico is also complex and has a lot of challenges and demands and priorities. How does childcare break through, and why was that the choice? And what have you seen in terms of impacts across other areas that people may not recognize? Oh, that also helps with housing issues or poverty or cost savings X, Y, and Z. Can you just share a little bit more about that thinking and the priorities?
Yeah, I think the governor, and Ryan mentioned it, kind of the staggering statistics that people often associate with New Mexico, and 50th in child poverty, 50th in child well-being, and hunger and education, and it was this, I think, that was like, we know the promise when early childhood opportunities are delivered, with quality and consistently, that children do better, families do better. And so I think she saw that, and I would give credit to many people in the legislature and the advocates, the people in the community said, this is our, I don't know if you Star Wars, but this is our only hope. Here is our last hope, is if we do it well and we do it right. And so I think she saw that and didn't give up in it, and to be family-centered and child-centered. She put a lot into education. She saw that our K-12 education system was struggling. It was not student-focused. It was not where it needed to be. And so I think this has, pushed and helped improve those other systems. We work very closely with our child welfare system. We also have very troubling statistics there too. But now our home visiting programs are integrated, with the child welfare teams, with our Department of Health teams. So it has been great being a cabinet level, sitting there. I'm in the health huddle and I'm in the education huddle. And that's the reality of early childhood, is we are as much about health and human services as we are about education. And so I think it has helped having my voice, or the voice of early childhood, at that cabinet table, and working across the children's cabinet that the governor reestablished.
I just want to add, it's very interesting because we have a conversation obviously here about homelessness in San Francisco or in Los Angeles, and it's a similar conversation in the sense that it's so spread out in terms of who you go to, of which division of the city or the county or the state to try and get help. And so really kind of a lesson I'm taking away today is just you have to have everything under one view, otherwise you're not able to even identify where the problems are. Is that kind of a
Yep. And the governor did create the Office of Housing in this last session. She had the most successful session of a lame duck governor in New Mexico history. I think she got everything: universal child care, Office of Housing, and lots of money for housing. But you're absolutely right. Having that coordination, we're constantly now looking at, how are we interacting with early intervention? Oh, in the bill, the child care bill, there was a lot of interest in how early intervention, trying to get into child care centers and deliver those services, and being excluded. And so you'll see some language in the bill around how we have to, how that has to be reported and how we have to work on that. So it's another important system issue, because it's true. Early intervention providers shouldn't just show up anytime at a child care center and not understand, but also child care providers should not exclude and cannot exclude them from getting those services. So it really brings to light, and then we have the levers to work together to improve it.
Any other questions? Oh, okay. Let's go in the back. Or okay, you're deferring over here. Okay, yes. Let's go here then. And then, just name and kind of affiliation.
Hi, I'm Ingrid Mesquita. I'm with the San Francisco Department of Early Childhood. So amazing work. I love New Mexico too. I'm not affiliated with New Mexico at all, but I just love it.
You're allowed to love it, even if you're not Mexican. Yeah.
I'm just curious about the funding, because you mentioned that it's part of the land grant. It goes through obviously the state legislature. What's the timeline that if you're going to be reaching $1 billion hopefully soon? What's the timeline for spend down of that, or is that in perpetuity?
So let me see if I have it right, and I definitely need to talk to you. I understand, so I'm excited. I didn't know about San Francisco's office. And so the land grant, that's a great question. So we get a distribution of the corpus of the fund annually, 5% of the corpus, or $500 million, whichever's greater, from the trust fund. And from the land grant permanent fund, we get 0.60% of whatever is of the corpus of the land grant permanent fund. So we get that annually. The legislature decides how it gets appropriated, to which programs, which services, and I hope that answered your question. And then we have in the universal child care bill, they can also appropriate up to $700 million out of the trust fund for child care assistance between now and 2031. So exactly. And when we started, we were a $400 million budget in 2021, and this 27 will be $1.2 billion. That's going to be a great question. We want to make everyone addicted to universal child care between now and 27. And we're going to build some moats around key legislative people so that we can keep them from doing anything. But there will be a cliff effect if they don't do something. But we're hopeful that they would then just increase the distribution, or, the land grant's more complicated because it's a constitutional change that Congress has to also approve.
And so I think we have time for one more. I think there was one in there. And by the way, we get together whenever we have these events and think, what is our audience? And this time we said we think it's pretty policy focused. And you just said the sentence, I believe, you get a disbursement from the grant of 0.06%. So we are, this is definitely a policy focused event.
Exactly.
Are there any more questions? I think there was one in the back. Yeah, let's go right there in the back. And again, name and affiliation.
Hi, everyone. Meg Evans. I'm with Blue Meridian Partners. We're national philanthropy. And so at the risk of taking us away from policymakers in the room, I'm curious that same question around, do you have advice for philanthropy on how they were most helpful in this process, either state or national?
Yes, and I should have said that. I mean, I mentioned philanthropy in my remarks, but the Conrad Hilton Foundation, Heising Simon, Kellogg have all leaned in hard with us and were really instrumental in helping us have the resources and the infrastructure we needed to move some of these big policy goals, communications goals. So nice to see September here. But you got to lean in. I mean, states who are doing this or localities, they need the resources. They need people, boots on the ground. They need researchers. They need communications teams. And so I would say definitely look for those promising places in New Mexico. And that's what's happening. And we're so thrilled because keeping up with this, I mean, state government, you're always moving. You're always trying to keep things going. But you're constrained sometimes by the type of support you can get. So I would encourage you to do that and think system level change.
Great. Well, thank you very much, Secretary.
Thank you.
That's fantastic.
Really good.